Dr. Kevin Kavanagh. Good morning, Dr. K.
Good morning, Jack.
We start this morning with sad news about a congressman who has died at a very young age, like 41. Tell us about that.
Well, yes, he unfortunately has died of COVID. He's a congressman-elect out of Louisiana, Congressman-elect Letlow. And this really does point to the fact that this is a deadly disease. It can affect the young. Of course, I feel 41 is young. I'm sure my grandkids will say it's ancient, but nevertheless, it affects everyone. And also what's disturbing is that there are a number of important votes which are coming up and decisions our country needs to make, and we really need to get our leaders protected. And that means vaccinated, and they need to follow public health advice. It is critical for national security. This virus affects everyone.
The thing I'm hearing most about relating to COVID this morning is this, what they're calling, a new strain of it, or it's got another name.
Well, yes, it's a new strain of COVID-19. There's actually two of them. One is in the United Kingdom and another in South Africa. We know not as much about the one in South Africa, although there are some reports from their Ministry of Health that that may actually be affecting more of the younger population. This strain is felt to be more infectious, at least 50% more infectious, and the strain itself may actually already be in the United States. It's been detected in Colorado. That's been our first case. And because of this, it raises concern. Now, we need to add, we do not feel the strain will affect the vaccines, and it doesn't appear to be more lethal or cause more serious disease, but it is spread more easily. And this is a concern because we're being right now overrun with COVID-19. And of course, more people that get infected, the more people can die. And so we need to really be cautious over this holiday weekend. Cautious means essentially staying at home. Jack, I know everybody wants to go out and celebrate New Year's Eve. And granted, there's no year that you want to celebrate coming to an end more than 2020. But we really need to back off on that because unlike Christmas, and I'm not saying Christmas was safe, but New Year's Eve parties tend to be like a big bar party. Too many people get together. There's a lot of loud vocalization, shouting, sometimes singing, and this is just a setup for the spread of this new strain of virus or even the old strain of the virus. So New Year's Eve, New Year's Day, we really do need to stay at home within our family unit.
I was also reading this morning that this new strain they had assumed that it was probably here, but they've determined that it is for sure in Colorado. Is that right?
Well, that's correct. And one of the things that disturbed me is that you hear all this, well, we assume it's already here, but we don't know, we can't tell. And that really points to, I feel, the fact that we do not have a robust surveillance mechanism for the different strains of COVID-19. Now, of course, that means genetically sequencing the virus, but we need to be doing this in a lot more places. We need to be doing it in a very systematic way and have it widely available. We need to up our surveillance, not just on the testing of whether or not the virus is there with like a PCR and antigen test, but actually sequencing a number of these strains so that we can determine whether or not we've got a significant mutation and we need to be wary about this. Countries like Australia and England, they're far ahead of us in this. We always think we're number one in the United States. Well, with this strain, I think it's shown that we've got a lot of catching up to do in a lot of our public health initiatives and strategies.
And we don't know yet what kind of January we're going to have as a result of the holiday surge of the coronavirus, because it'll take a few days before it starts raising its ugly head. And I know both the president-elect and Dr. Fauci both yesterday were saying it could be the worst January in history.
Well, and I think that's true. And I'll be honest with you, I'm really worried about our reporting system. I think it's going to be overtaxed, overwhelmed. I mean, if you're in Southern and Central California, you have refrigeration morgues You've got people who are dying right and left. You're running out of staff. You're running out of the capacity to give oxygen, which is what's currently happening. They're turning away ambulances. You really don't have the staff to go back and fill out an extensive form and information for an investigation on each one of these deaths. It takes away someone from the front line. So I think there may well be underreporting. You're going to see this over this last week where we have holidays and people off on vacation or trying to kind of get together with their families and get their nerves kind of calm down. All of this is going to put a strain on the reporting system. So I think we're going to see a number of things. We are going to see elevation cases, but I also think at some point we're going to see underreporting because, as I've stated before in the show, statistics are used to predict the future and try to prevent things from happening. We're in the thick of it now. You know, in California, you're as bad as it was possibly imagined to have gotten earlier this year.
We're going to move you up a day and have you back with us tomorrow. We'll be taking New Year's Day off, and we thank you, Dr. Kevin Kavanagh. We'll talk to you tomorrow.
All right. Thank you very much, Jack.